Well, it's changed significantly. I mean, the first and most important aspect is that the scope of available services that are offered to patients today is vast. There are multiple solutions that patients have available to them for the same one condition they may have. The second one is that technology is expanding all over our society, but technology is also expanding within the world of dentistry, where there's so many things that we can do for patients. Like we've got early diagnostic tools to detect certain medical conditions or dental conditions at their earliest, most treatable phase. We've got things like computer-aided design milling machines that can be used within a practice to make better, stronger, longer-lasting restorative materials. And even lasers. Lasers are in dentistry today where we can use them to make procedures more comfortable, to stimulate the healing after the procedure, and to actually enhance the quality of the procedure itself. And actually, if I could add, something else comes to my mind, is there's a shift in focus today I find within dentistry from corrective medicine to that of prevention, where doctors today don't just necessarily want to wait until you have a disease or a disorder within your mouth. They want to try and find and intercept them at their earliest, most treatable phase. And there's many things that they do to focus on that. They also want to offer you long-term solutions. In other words, rather than just putting another filling on that tooth, doctors will look at things like your age, the average life expectancy, and they want to put solutions within your mouth that will last you a long time, feel comfortable in your mouth, work well for you, look good, and all sorts of other aspects. So there's much that's going on in the back of a dentist's mind when it comes to treatment planning and decision making. Well, dental professionals understand that there's a person attached to a teeth. I've got a client that once told me, he says, "Peter, I've never seen 28 pieces of enamel walk through my front door. They're attached to a person with feelings and with needs, and our job is to package the dentistry into their lives." And I love that because I hear that so often in clinics all over Canada. Dentists care about people, and they understand that when a human being walks through that front door, they're not just a mouth with clinical needs. They're a person. They have feelings. And what we do within the practice has to be designed to, or is designed to touch the larger human condition. So practices today will even create spa-type environments where your dentistry is not just pain-free. Dentistry should be comfortable. In fact, it should be an emotionally fulfilling experience, the doctor-patient relationship. And doctors will do things like providing you with neck supports, giving you hot towels after your treatment is done. Chairs, some of them have little massagers. They have TV glasses that you can put on to forget that you're sitting in a dental chair having dental treatment done. Basically, in a nutshell, dentistry is about people. The procedure itself is not just pain-free, but should be something that is comfortable, fulfilling, and that engages that person to be interested and inspired in the whole concept of oral health. And your dentist really is a partner in that process. Oh, they're changing a lot. The old school model of take 2 of these and call me in the morning, trust me, I'm a doctor, is fading. Today consumers arrive informed. They want choices. They don't just say, "Tell me what I need, doc." They want relevant information that makes sense to them. They want to be involved in the choices and the treatment planning of their care. And ultimately, they want an experience that is emotionally fulfilling, at the same time, one that they're in control of. And doctors provide environments for their customers today where they don't just tell them what they need, they guide them in self-discovery so that patients can tune into their own best interests and their own needs. Well, dental health, and actually I have something, I want to read it to you here. It's from a certain public health unit that I received from my son's school, and it says, "Dental health contributes to general health and well-being. Dentists, the profession of dentistry, and dental hygienists realize that the mouth is the gateway to the body. We're just not providing procedures in people's mouths. The mouth impacts how people live and feel. And a dental professional's goal is is to help people to eat, speak, and smile, and socialize unhindered by pain, discomfort, or embarrassment. So dentistry really is a place where you can go to have to experience better quality of life, to experience a happier, more confident you as you navigate through life. I find that dentistry today can impact people professionally, socially, medically, and in all aspects of their lives. That's why it is so important to dental professionals that consumers, the dental patients, engage in discussions about their needs so that treatment plans can be customized and suited to the unique needs of the person attached to the teeth. Canadian dentists are caring and loving people, right, that are really trying to balance the working of their business with their primary goal, which is to take care of the people attached to the teeth. And sometimes this part of it can be challenging for people because I find most dentists, what they just want to do is they want to serve people in the best possible way so that they can walk out enjoying their quality of life and reaping the benefits of good oral health, which contributes to total health. Dentists today recognize, are taught in schools to administer the best procedures in a comfortable, caring way to patients. But the most important thing to remember is that when you're holding dental instruments in your hand, what you're in fact holding is the life and feelings of the person attached to those teeth. And value in dentistry is not just in the quality of the procedure itself, but it's in the quality of life benefits that your patients will experience long after they've forgotten that you placed a crown in their mouth.